Hey, what's up, Papa?
What are thyroid disorders?
Okay, so the thyroid gland is located here on the anterior portion of your neck. It's important for students to know that the thyroid gland secretes something called T3 and T4 and calcitonin, but that does not influence metabolism. Let's focus on T3 and T4. And your pituitary gland, your anterior pituitary gland, secretes something called TSH or thyroid stimulating hormone. And that hormone dictates what these hormones do. And ultimately, it controls something called metabolism. And so metabolism is like your body's engine, your body's furnace. If your metabolism is high, it's burning really hot. And if it's slow, then it's not burning hot at all, it gets cool. And there's two major conditions. We're talking about hyperthyroidism or Graves' disease. And this happens when either the problem could be at your pituitary gland or your thyroid gland. That's going to differentiate the lab values, by the way. So for instance, if you have hyperthyroidism, Graves' disease, and it's caused by a tumor at the pituitary gland, then your TSH will be high. Therefore, that's causing your T3 and T4 to be high. And that's hyperthyroidism, Graves' disease. But if the problem is at your thyroid gland, then your T3 and T4 will be elevated, but your TSH will be low because it's trying to fix the issue. People with hyperthyroidism, they're going to have tachycardia. They're going to have oily, sweaty skin, oily, sweaty hair because all the cells are functioning really fast. You're going to have heat intolerance, which means that the patient's body is always hot. You're going to have increased intestinal motility, which means you're going to have chorro. You're going to have diarrhea. Patients with hyperthyroidism will also develop something called exophthalmos. And exophthalmos is when the eyes begin to get pushed forward and they're bulging outward. It's important for nurses to understand some considerations that include putting eye drops to keep the eyes lubricated so they don't get too dry. And also, as the patient sleeps, the eyelids open up because the eyeballs are so big, they're pushing forward. So you should put tape to close the eyes, or you should wear eye patches so you don't develop corneal scratches. People with hyperthyroidism, again, mentioned tachycardia, they're going to have hypertension, they're going to have nervousness, they won't be able to focus because their metabolism is so fast. Imagine running on a treadmill and trying to read a textbook. And I mean running on a treadmill like doing like at level 8 or 9, which, as I recall, that's pretty fast. So my point is, people with hyperthyroidism, they have a hard time focusing because of all that. The things that we do to correct hyperthyroidism usually include a thyroidectomy or transphenodal hypophysectomy, which is the removal of both of those particular glands. Now, we have hypothyroidism. Now, hypothyroidism is when you have a slow metabolism. That means it's the complete opposite of hyperthyroidism. So you have bradycardia, you have hypotension. You still have a lack of focus because patients can't focus because their metabolism is so slow, right? The neurons aren't firing fast enough. People also have constipation as opposed to diarrhea. Patients are going to have an abundance of adipose tissue. They're going to have be a little bit fat because their body's not burning the calories. So that influences dietary preferences, because if your patient has hypothyroidism, you got to decrease the caloric intake. But if they have hyperthyroidism, you want to increase the caloric intake. So just keep those two things in mind. People that have hypothyroidism, they also have cold intolerance, which means their body can't really deal with cold temperatures because they can't warm up because their furnace, their metabolism is slow. You have to be careful with people with hypothyroidism because they can develop mixed edema coma. That means that the metabolism slows down so much that the patient slips into a coma. Now, this does not stop vital functions, meaning the patient will still breathe and all that good stuff, but the patient will be in a coma and will require medical assistance. The medical interventions for hypothyroidism usually include synthetic forms of those hormones. We're talking about synthroid levothyroxine because those increase the secretion of T3 and T4. And in a nutshell, that's the main difference between hyper and hypothyroidism.